Hello, and happy holidays to you and your family. As we wrap up another year, I'm reminded again how thankful I am for everyone here at the Maryland Department of Health, including the public health heroes working at local health departments and communities across Maryland. The work you do preventing disease, investigating outbreaks, and promoting health and wellness really does make a difference to Marylanders. Here are just a few examples of your good work across MDH in 2024.
This year, the Office of Suicide Prevention worked with experts to develop the Maryland Action Plan to Prevent Suicide in Schools, or MAPS. MAPS is a comprehensive reference guide which includes training tools to better equip educators who are often the first points of contact for struggling students. Another important initiative in 2024 was our launch of the first in the nation Trevor Train the Trainer pilot program to help LGBTQIA+ youth. This is the latest program in our ongoing collaboration that began last year with the Trevor Project, a leading suicide prevention organization for LGBTQIA+ young people.
As part of our comprehensive effort to combat the overdose crisis, we launched a new tool, the Maryland Overdose Data Dashboard. The dashboard provides easy-to-understand visualization of overdose trends to help partners throughout Maryland reach the most affected communities. It also provides insights across age, race, and gender for proactive monitoring and targeted overdose response.
In May, the Bureau of Maternal and Child Health hosted the inaugural Maryland Maternal Mortality Summit at Coppin University in partnership with the Maryland Patient Safety Center and featured speaker First Lady Dawn Moore. At the summit, MDH introduced the Women's Health Action Plan and the State of Birth Equity Partnership, both created to eliminate Maryland's preventable maternal deaths and address inequities in maternal and infant care. The Women's Health Action Plan prioritizes health equity for non-Hispanic Black women and those residing in rural areas who are disproportionately impacted by maternal mortality. The plan includes strategic actions to strengthen reproductive healthcare rights and access, expand community-centered health services, and support the perinatal workforce.
In April, Maryland Medicaid completed a year-long redetermination process for medical assistance eligibility. Maryland Medicaid was among the top states in using federal flexibilities and waivers to assist individuals and help ensure eligible individuals continue to receive Medicaid benefits. In collaboration with other Maryland state agencies, we were able to maintain coverage for those who are eligible, resulting in more Maryland enrollees now than before the COVID-19 pandemic. Maryland Medicaid processed more than 1.5 million renewals in 1 year, and more than 70% of those reviewed were eligible to have their coverage extended. Governor Westmore was a key part of our statewide public awareness campaign, appearing in a video to help educate Marylanders about the enrollment process.
DDA recognized Developmental Disabilities Awareness Month in March with a video campaign entitled Innovations in Our Communities. We featured our participants as well as the work we do with trusted community partners and organizations to transform the landscape of care and support for individuals with intellectual and developmental disabilities. We also continue to be pioneers in assistive technology as a tech-first state, celebrating our 3rd anniversary this year. We are a national leader in empowering all Marylanders with disabilities to have access to technology that will help them live, work, and play in their communities.
After a comprehensive multi-year process, the Public Health Accreditation Board has reaccredited the Maryland Department of Health for another 5 years, indicating that MDH continues to meet stringent quality, innovation, and improvement criteria. Public health accreditation is based on evidence-based standards that measure the department's ability to provide a high level of service, performance, and accountability to our residents, to our communities, and to policymakers. We are so glad to have had the opportunity to showcase the great work done by the dedicated and talented public health professionals here at MDH, and for that work to be recognized by the accrediting body.
This year marked the 20th anniversary of the Office of Minority Health and Health Disparities, and we recognized this important milestone at our annual conference at Morgan State University. Since we were created in 2004, our team has worked hard to address social factors that affect health and to reduce health disparities across our communities. At our conference, we also honored individuals in our communities who have made significant contributions to health equity and access.
The public health staff of Infectious Disease Epidemiology and Outbreak Response, the Environmental Health Bureau, and the Public Health Laboratory collaborated with the Baltimore City Health Department to solve a national public health mystery. Working together, MDH helped stop the largest multi-state listeria outbreak in more than a decade. Maryland's investigative success led to a recall of more than 7 million pounds of deli meats, undoubtedly preventing additional illnesses and potentially deaths. MDH received national media attention for the important work that we did in this case, and we work hard every day to help ensure Maryland's food and water are safe.
This year, the governor invested $13 million to improve and expand mobile crisis services in counties throughout Maryland, and to begin to establish behavioral health crisis stabilization centers. When someone has an urgent mental health need, mobile crisis teams meet them wherever they are, at a home or in the community, to provide immediate support. These teams, which include a mental health clinician, will help people of all ages 24/7. You can connect to the service by contacting the 988 Suicide and Crisis Lifeline, which provides free emotional support to all Marylanders. If you or a loved one is feeling overwhelmed or is struggling with drugs or alcohol, you can call, text, or chat 988 24 hours a day, every day of the year.
For every one of these highlights, there are hundreds more deserving recognition. I promise we will do our best in the year ahead to keep shining a light on your great work. I'm excited for 2025, and I hope you are too. Together, we make a difference for Marylanders.
Happy holidays and Happy New Year!